Beyond Big Pharma. How convenient. We're supposed to believe that former President Joe Biden, just diagnosed with a very aggressive form of prostate cancer, that he was, I guess, too old to undergo a PSA test because his prostate might just be too ancient to bother checking. Never mind that the medical system loves poking and prodding everyone else into oblivion for profit. Apparently, when you're a former president, the rules of overdiagnosis don't apply. Just wave the he's too old card and call it a day. Well, back in 2012, a researcher by the name of Alan Cassels sounded an alarm in his book Seeking Sickness, exposing how medical screening fuels overdiagnosis, overtreatment, and pharmaceutical profits, often at the expense of our health. 13 years later, his warnings ring truer than ever as chronic diseases soar and healthcare systems buckle. Are we ready finally to rethink a medical model that prioritizes pills and procedures over prevention? Pam Killeen is a health and wellness coach, co-author of The Great Bird Flu Hoax, and host of the Circadian Reboot with Pam Killeen podcast. Hey, Pam, how are you?
I'm great, thanks. Thanks for bringing up this subject today, and also for bringing up the work of Alan Cassels. And he's written, as you mentioned, the book Seeking Sickness, which came out in 2012. And prior to that, he wrote another book called Selling Sickness, which came out in 2006. And he's done so much research into the numbers, Richard. In other words, how valid is all of this treatment or all of these screening procedures? How valid are they? Are they really helping us as a society? And the bottom line is, if you want to go for all these screens, all these tests, all these treatments, that's entirely up to you. But from an economic standpoint, many of these things are not valid. They're not really improving outcomes. And prostate cancer is no different than other things he studied, where he's basically looking at it through the lens of a statistician. And he's saying, you know, when you look at some of these countries where men don't do a thing to treat their prostates, they just leave things as they are. They have some swelling down there. They go to the doctor, they get diagnosed with some kind of prostatitis or what have you, and they leave things be, and their outcomes there are similar as they would be here in North America, where they may be doing mild to aggressive treatments on the prostate. So his revelations were quite astounding 13 years ago. And he did rock the boat. And I think things have improved a little bit, Richard. I'm not a guy, so I can't really speak to this. But I think they have cut back on the amount of poking and prodding that they used to do back circa 2012. Right. So I think they're using MRIs more than they would be using those a dozen needles in the prostate area. And unfortunately, doing biopsies increase the risk of all sorts of symptoms, including the risk of developing serious infections. So these aggressive treatments and screening procedures hopefully are becoming more and more a thing of the past. And the reason why is because even the Journal of Clinical Oncology back in 2016 said that in the United States, almost 2 million men were overdiagnosed with prostate cancer and unnecessarily treated. And that's not a small number, Richard. So the side effects of being treated for prostate cancer can be devastating, not just psychologically, but you can develop things like erectile dysfunction, or you can become incontinent and so on. There's a lot of devastating symptoms if you are treated for prostate cancer, and the outcomes are, terrible.
Right. Well, but in Joe Biden's case, and let me just say off the top, and not to get too conspiratorial, I thought the timing of the announcement that he has, what do they call it? An aggressive form of prostate cancer. It's already metastasized to his bone. I thought the timing was very interesting because they just released the Robert Hur interview with Joe Biden audio, in which Joe Biden is, just totally incoherent and rambling. And Robert Hur was investigating the way that classified documents were handled by the former president. And Joe Biden had, no idea where he was or what he was talking about. Couldn't even remember when he was vice president and so forth. So the timing of this announcement is, I think, kind of a distraction. But putting that aside for a moment, couldn't a PSA have, I don't know, told us or told the president that he had a serious prostate issue before it metastasized?
Listen, I'm going to speak from a conspiratorial standpoint here. I looked into it because I was suspicious like you. And wouldn't you know it, one of the treatments for prostate cancer is something called androgen deprivation therapy, ADT therapy. And guess what one of the side effects of that therapy is?
Dementia?
Cognitive decline. So I have to wonder, if I were an American in the States, I'd be demanding, I'd be saying, is this a treatment that he's been undergoing for many, many years now? I mean, yes, he's an older man. And yes, you can have comorbidities. So you can have prostate cancer and you can have cognitive decline. They're not necessarily linked. But in his case, I wonder if he hasn't been undergoing that treatment now for many, many years, and it accelerated his cognitive decline. And so it's something I'll just put on the table, Richard. I can't prove it. I looked for information to see if he's been undergoing those types of treatments, and I couldn't find any evidence of it. But it's his age. I mean, at his age, you're going to see people suffering with prostate cancer. You're going to see people suffering with cognitive decline. It's just something that happens. But is his cognitive decline associated with the prostate cancer and the treatment he may have chosen? I guess we'll find out.
Right. Just a last question, and quickly. I mean, with chronic disease rates continuing to rise, despite all of these, advances in medical technology and so forth, what role should nutrition and sleep play in reforming healthcare?
Well, I think they should be at the top of the list, along with getting enough exposure to the sun. Speaking about prostate cancer, prostate issues in general, lack of sun exposure, by the way, is associated with prostate issues, because if you're not getting enough sunshine, if your circadian rhythm is off, you're not producing enough melatonin, you're not producing enough vitamin D in the body. This causes inflammation, which is associated with prostate issues. So I think sunshine should be right at the top, and reducing your exposure to artificial light is also at the top of the page, because that's associated with increased risk of cancer. And then you have, yes, high quality sleep, which is associated with your relationship with both sunlight and artificial light. And of course, eating a nutrient-dense diet is critical for health. So yes, I'd say all three of those things combined, Richard, are critical for sustaining our health.
Pam Killeen is a health and wellness coach, co-author of The Great Bird Flu Hoax, and host of the circadian reboot with Pam Killeen podcast, pamkilleen.com. Pam, Killeen, pamkilleen.com. Thank you as always, Pam.
Thanks, Richard. Thank you for listening to today's episode. If you'd like to hear Alan Cassels talk more about his views surrounding PSA testing, prostate cancer treatment, please refer to an interview that Andy Oudman and I did with him back in 2011. It's episode 18 in my Truth Over Spin podcast series. And if you would like more information about how to reset or reboot your circadian rhythm, please refer to my website, www.pamkilleen.com, or refer to many of the podcasts I've done on my Circadian Reboot channel. Thanks again for listening, and I hope to see you again soon.